And I told him, I said, I'm going to call the police. He's never said he's going to kill himself or do anything like that.
He'd never said anything
ever
about
talked like
suicide
that.
Never.
Okay.
And I knew Teresa's mom worked at the police station, plus they'd already visited with me and told me he was out of his mind at 3:30 in the morning. And he kept telling me, no, I just need 72 hours to prove all this. Don't call the police or do anything. I just need 72 hours. So, but he was getting worse. He was telling me how he had to go. He just was talking to his phone and talking to people that weren't there. So the police came right away, and it was Patrol Officer Ward.
It was Officer Ward.
And so he came within probably 5 minutes of me talking to Teresa. And I was standing outside the doorway, and so was Chris, and Michael was in his doorway. And so that Ward came up, he goes, what's going on? I said, my son told me that he's going to he's going to do something so you guys shoot him and kill him. And I said, he's out of his mind, he doesn't make any sense, and I want to get him committed. I want to get him into the hospital because he wouldn't get in the car or go anything with me. And so Officer Ward says, okay, well, let me talk to him for a second. So then he goes, Michael's in the doorway, and he goes, hi, how you doing, Michael goes, fine. He goes, so you told your mom, like, you're going to do something? He goes, I did not. And he goes, I'm not going to hurt myself, and I'm not going to harm anybody else, and she's a fucking liar. And he has never talked to me in that manner. He would never say that to me. And so Officer Ward goes, okay, so you feel fine? And he goes, yeah. He goes, I'm not going to do anything. He goes, okay. He goes, well, listen, let me talk to your mom and your brother here outside, and you wait inside. I'll talk to them in private, and then I'll come talk to you. And so then he pulled Chris and I over. He goes, well, you heard him. He's very smart. He goes, I can't do anything. He just told me he's not going to harm himself. And I said, but last night you guys called me, because he wasn't making any sense either. He goes, yeah. He goes, I talked to the officer last night, got the report. He goes, but he just told me he wasn't going to do anything. So there's no law against being mentally ill, so I can't do anything. He goes, but you could try. Well, he goes, well, we tried it once in Sergeant Bluff and it didn't work, but there's this group called MCAD that they can come sometimes. I said, what is MCAD? And he goes, well, they have kind of some luck with it in Sioux City. He goes, but it's a group of young people that come from Jackson Recovery and try to talk to him. I said, Jackson Recovery, that's where he just signed out of. We bring somebody from Jackson Recovery, and it's just, he won't go with, it's just going to get worse. And so he goes, well, he goes, then I really can't do anything because there's no law against being mentally ill. And he goes, but I'll tell you what, I'll take down your name and your number, and I'll call you because I'm sure he's going to wander into somebody else's property. And he goes, and I suggest that maybe you and your son go down to the courthouse and sign papers to have him committed, and maybe you can get him get him some help that way.
So you were all talking outside.
Yeah, and he just wandered away, Michael did.
Is there a back door that you wouldn't
No,
have seen
he came
him
right
there?
out the
He
door.
went out the front door.
You
we
were
were
out
on the
the-
side door
Okay.
talking in the
And he
driveway.
just left.
I didn't
went
know he
looking for
left.
him.
I would have never sat
I was
there
walking
and talked.
around the house looking for him. I couldn't find him. And finally I said, I'm going to go find my son, And so I got in and back past the cop and Christopher's car and went to look for my son. And I was going looking for him. And then Chris finally left too when he realized Michael had left. The police officer didn't even talk to him. And so he went to look for him too. And while we were both driving home, a neighbor texted him.
Yeah, as soon as Ward and I got done talking, we got in our cars and drove off. He went one way and I went. As soon as I turned that corner, my neighbor started texting me from across the street saying, there's a strange guy in your yard. Looks
So he
playing
walked
in
a
the
mile
snow."
over here again.
So
Okay,
he walked,
so-
during that conversation, he left that house, walked over here, went into my house, grabbed my gloves, played in the snow pile I had outside. She texted me, and then he wandered over and was climbing around the fence. And when
From
we
that
pulled
old
up, he
fence,
was
yeah.
hanging on that fence.
And he's just talking away to nobody.
So then I pulled down here, went out and talked to him for a little bit. And couldn't get him in, trying the same thing, trying to get him in the car. Come on, Mike, let's go. And he wouldn't do anything. So I sat there with him a little bit, listening to his story. Mom sat there on the corner, watched him.
I watched him for like 20 minutes just talking and doing nothing. And finally, then he rolls back under and he comes over to my car and goes, "What are you doing?" And I said, "I'm watching you." He goes, "Well, they finally told me what I need to do." He goes, "I need to go west, so I need to go home and pack." I said, "Okay, why don't you hop in my car and I'll take you home." So then he got in the car with me and I took him back over to his house, and then he just started packing his clothes as neat as could be. He was folding them nicely. I said, "Where are you going?" He goes, "They told me I have to go to Westchester, PA. And I said, "Why do you got to go Westchester?" He goes, "Because that's what they said." And he'd look at his phone and he'd kind of mumble some stuff. And who knows who they is? That's who he's talked to on the phone. And
It was so
mumbling.
bizarre.
And then I said, and it kept packing. I said, "Michael," I said, "the only place you're going is I'm going to take you to the hospital. You need to go into a mental health facility. You're not in touch with reality at all. And you need to go." And he goes, "I told you I'm not going anywhere. And I'm not going to be committed." And so then I said, "Okay." I said, "I'm going to call David," because he knew David was the lawyer. And I said, "I'm calling David because you're going to have to be committed then. I'm going to have to go to court." And so then I called my brother to come over to get him to help me, figure out what to do. So he came over and he was talking to Michael. While he was talking to Michael, I got in my car and I called his doctor. And I talked to the nurse. I said, "You're, Michael's doctor, so-and-so's patient." And I'd met her and I'd been there with her when we got him committed, Jackson Recovery. And I said, "Michael is not making any sense. He's hallucinating. He's threatening to have the police kill him and commit suicide by a cop." And I said, "And I'm here with my brother and his attorney, and we want to see, would you guys at least just direct and admit him to a mental health facility?" And so she goes, "Just a minute." And then she comes back and goes, "Doctor says that she's never heard him talk like that or make a threat, so there's nothing she can do. So they just suggest that you try to get him court committed."
You'd need
Kind
to
of
go
blew me off and just
to
said,
court to
"Go
do
to court
that.
then." Yeah.
And so that's when
Well, I was already there when she was.
Yeah, when I was talking to the doctor, he was
that's
there.
when you're talking to the doctor. Were you here at home?
No, I was in my car at Michael's house, and he was talking to Michael on
Okay.
the porch.
We were all sitting
So
in the
while
driveway.
he distracted,
you
talked
were
to
over
I was
Michael.
there
there as well.
Yeah.
And all three of you were there.
Oh, yeah.
Yep.
Okay.
And so
I
while
was
they
there
were
all
talking to
morning.
him and distract him, I got in my car and I called the doctor to ask her to direct him
Okay.
to a mental health facility.
So then he said, really wasn't anything going on. And I said, "Well, Michael, your mom is telling me and Chris is telling me about all of these very strange stories that you're telling them that gives me concern about how you're doing, mentally." And he said, "No," he says, "I just had a puff of weed." He says, "I'm okay, I'm calm." He says, "I just haven't had any sleep since Friday night." And so I said, "Well, why haven't you slept since Friday night? Because this is now Wednesday morning." And he said, "Well, I haven't had anything to drink since Friday night." And while he's sitting there, he's sitting on the stoop and his hands are just, he visibly has tremors. So I said, "Michael, I think that you are detoxing right now and you're doing it in a very unsafe circumstance."
It was a cold stop of the alcohol. And then I think that maybe alcohol might have helped him sleep. And since you're not drinking, it's just
Okay.
stressed out.
I do court appointments, hundreds of them. And so I know that when clients are in a mental health crisis, and if they've been drinking or detoxing in an unsafe way, the potential for them to be out to be out with police interactions with catastrophic results are real. And so I said to Michael, "So Michael, it looks to me, I can see your hand shaking. You tell me you haven't drank since Friday night." And I was aware from my wife helped Carol. My wife is an employee of Rosecrans Jackson. And when in August, Michael needed the assistance that Carol wanted to see him get with respect to trying to assess and then treat him for the alcoholism that was becoming apparent. Lee helped, facilitate his admission. So I was aware of that also, and when I see him visibly shaking, I said, Michael, I believe you are detoxing. We need to get you to a hospital where you can detox safely and where you can get the mental health assessment that you need right now. So why don't you come with us and let's just go on up to the hospital. And he said, no, I'm not going, and I'm not going to. And I said, Michael, you need to get somewhere where we can get you stable and you can have some assessment of your mental health issue and then get you into treatment, because we need to deal with this, use of the alcohol, the abuse of the alcohol. Nope, I'm not going. I said, Michael, why won't you go? Because in August, they let me go to inpatient treatment. And if I ask them again, if I were to go to treatment for them to let me have more time, I'll lose my job.
Yeah, he started talking about his job then.
I said, Michael, that's not true. And I was aware that, from family interactions, that Michael was respected and valued by John Gleason and the Gleason companies. And Michael, that's not true. You're not going to lose your employment. They value you. You're in a crisis right now. They'll work with you. So let's just get you up to the hospital. He just wouldn't go because, at least the rationale offered to me was, he was afraid he would lose his job if he went up and got an assessment. And I mean, these are my words, it isn't him articulating this, but he recognized what was going to happen, potentially, that there might be a recommendation, I think, about further treatment, because I was describing to him, that's what you need. I said, so Michael, what's your plan? I said, what are you going to do? He said, well, I just need some sleep. And he may have reaffirmed again that he had had a puff of weed and he thought he could sleep. So I said, well, why don't we do this? Why don't you go in, why don't you lay down, why don't you go to sleep, and you've got my number. You call me later when you wake up and we'll talk about what we might be able to do.